Coming right up, a special edition of Straight Talk on Scan Health Plan. Our guest tonight, Chris Wing, CEO of Scan Health Plan, and Sharon Jhawar, Corporate Vice President Pharmacy of Scan Health Plan, as we continue our 24th anniversary year.
Straight Talk is brought to you in part by the Port of Long Beach, a leader in international trade and environmental stewardship, and the Press Telegram, your local news leader for over 100 years, and Scan Health Plan for your health and independence.
Join us for tonight's edition of Straight Talk. And now your host, Art Levine.
Good evening and welcome to Straight Talk. We have a great show for you tonight focused on Scan Health Plan. And our guest is the CEO of Scan, Chris Wing. Chris, welcome back to our show.
It's always a pleasure to be here, Art.
I understand that you'll be celebrating your 5th anniversary with the company by the time this show airs.
It's been a great 5 years. The team and our providers are just doing a great job.
Well, let's look back at this year and indicate some of the accomplishments.
I think a couple years ago I came on the show and I said one of our goals was to become the best Medicare Advantage plan in California. We weren't going to measure it by profits or growth. We're going to measure it simply by membership satisfaction. And in 2016, our membership satisfaction is measured by Centers for Medicare and Medicaid Services, assessed that 90% of our members are satisfied with Scan. Second best in California. We're second to Kaiser. But we're doing great. And that really means so much for us and for the providers because it's really a proof point as far as how we're doing as a company.
And another critical metric is stars. And you got, we all remember in grade school, the gold stars up on the wall. And you went from 4 stars to 4.5 stars, which congratulations.
It's a really big honor for us. You know, we're in the top 7% now nationally as far as being a 4.5 star. It's a really big deal.
And a star not only affects your reimbursement rate from Medicare, so you have a financial incentive, but it also is an indication of the quality of the medical care you're providing.
Yeah, we're really proud of it. If we go back to the 12 angry Long Beach seniors who founded SCAN 40-some years ago.
SCAN is an acronym for Senior Care Action Network, and that was founded, as Chris says, by these
12 angry seniors
watch out
out of St. Mary's.
Watch out for those angry seniors.
40 years ago, and they had the same mission statement 40 years ago as now, improving the health of keeping our seniors healthy and independent. And if you take a look at our membership satisfaction and our quality stars, I think they are very, very pleased with the trajectory of Scan Health Plan.
Absolutely. And Scan will be celebrating its 40th anniversary next year. And a lot of folks know about Scan, but for those that don't, we have headquartered here in Long Beach a $2 billion a year Medicare Advantage plan that not only takes care of its members, but also, as you'll hear in a moment, takes care of the general community.
Yeah, we have a division of our organization called Independence at Home, and they just do some wonderful things. You know, one of the things they do is they actually go into nursing homes, Art, and they identify seniors who could be repatriated back out of the community.
Really?
So it's a group of pharmacists, social workers, case
Are they
management.
welcomed by the nursing homes who are grabbing their patients?
Well, they're a secondary consideration. But,
Yeah.
this is a great testimony to the work our staff does as far as really making a difference in the community. And that's just one of the programs we do.
Well, it impressed me that not only are you providing services to your members, which we'll be talking about, but also to the community at large. So Long Beach is the better off for having Scan as part of the community now for 40 years.
It's a mutual love affair. We're spending almost $12 to $14 million in 2016 alone on community benefit. But it speaks to who we are. It speaks to our DNA. And Long Beach is our home. We do some great work in Long Beach, and we're really pleased to be able to call Long Beach our home.
Nicely said. Have you expanded this past year into other communities, or do you have certain criteria where you determine whether or not to go into X community?
Well, I think over the next 3 or 4 years, we're really well positioned to grow into new counties in California. But we have 2 criteria. We want to make sure that there's a sufficient Medicare population. That's one criteria. The second, we will not go into another county unless we have a really strong partnership with a medical delivery system. Those are the two criteria for expansion. But I think over the next 5 years, we'll be going into new counties in California. We may do some acquisitions here in California. We're really well positioned to meet the needs of seniors here in Long Beach and in California.
And looking ahead, what are some of the strategic plans for growth into the future?
Well, one of the things we like to do is we are amongst best of class in the nation. That sounds prideful, and we're not a prideful company, but we've been taking care of people in their homes for almost 40 years. That's the legacy of our 12 Angry Seniors. And so this year we're launching a program called Connecting a Provider to Home. We're putting a team of a social worker or care navigator into attaching it to a team of primary care physicians to care for very frail seniors. We know that oftentimes the physician have no idea as far as what's going on in the patient's home. So we're the translator, we're the liaison between the physician's office and the home to make sure the physician knows what is actually happening or not happening, in the home. And one example, which is touching, and you'll see it in the video later on, is one of our seniors was not taking his eye medication, and he was suffering from that. And the doctor prescribed these eye drops that would have helped, but the Parkinson's was so significant.
Oh, he had Parkinson's.
He has Parkinson's disease. He shook so much.
He couldn't get him.
He couldn't get, for I think it was a $12 device. We were able to provide that to the senior. He was able to start taking his eye drops. But that's just an example. By connecting people into the home, they can tell the physicians what is or what's not going on.
And is that for members of SCAN and non-members?
It's for both, Art. We think this is really a big deal. There's so many seniors who need that extra little bit of help to stay out of a nursing home. And that's part of our DNA, it's part of our mission statement, and we're really excited about doing that.
If you are a senior at home and would like to find out if some of these benefits at no cost to you are available, we'll put that telephone number up later in the show when we're focusing on this. But take advantage of these programs.
We're here to help.
We're here to help. Well, in the next segment, we will deal with a very important link in the medical service, and that is the pharmacist. You told me on the last show we were at that your studies indicated that your members see pharmacists far more than any other person in the healthcare field.
That is correct. On average, our seniors see their primary care physician 4 times a year. They see their retail pharmacist 19 times a year. And every visit or every encounter with a senior is an opportunity to improve health care and reduce cost.
Excellent. Well, in the next segment, we will meet the Vice President for Pharmacy at SCAN Healthcare, Sharon Jhawar. Stay with us.
At the Port of Long Beach, we're not only delivering jobs, smart ideas, and forward-thinking environmental initiatives, we're also delivering opportunity for all of Southern California. Oh, and a clearer horizon line. To learn more, go to POLB.com. The Port of Long Beach, thinking outside the docks.
At Performance Plus Tire, you'll find we carry Toyo tires. For over 50 years, Toyo has been a world leader in the development of high-quality tires. Optimum performance, safety, and a comfortable ride. That's what makes Toyo tires great. And now come into Performance Plus Tire for a great deal on these Toyo tires. Proxys ST, Open Country AT, and Proxys 4. Toyo tires, driven to perform. Come in today and we'll install new Toyo tires on your vehicle while you wait. Performance Plus Tire on Cherry Avenue, 1 mile north of the 405 in Long Beach.
Welcome back. We're joined now by Sharon Jhawar, Corporate Vice President of Pharmacy. Sharon, welcome to our show.
Thanks, Art.
Chris, why is pharmacy so important?
Well, costs are spiraling out of control. Pharmacists have a key role as far as improving the health and the safety of medications with our seniors. So if we're going to keep healthcare costs and pharmaceutical products affordable, we need to have dedicated resources working closely with our providers.
Sharon, and you're in charge of the relationship of SCAN with the medical entities that link your members to pharmacists and drug use. Tell us about that.
Yeah, so I basically manage the prescription drug benefit for SCAN Health Plan. It's about a $150 million benefit, and work to ensure that our seniors get the medications they need from the pharmacies day in and day out.
And this concept of medical adherence, speak to that.
Yeah, so medication adherence is a huge challenge. You know, we all have positive intentions to take our medications, but for one reason or another, it just doesn't always happen. And so at SCAN, one of our areas of focus is ensuring that our members are getting the most out of their medications, such that they can be healthy and independent. And interestingly enough, the pharmacy benefit is the most widely utilized benefit at SCAN, with 83% of our members taking at least one or more medications.
And let's give our audience just a couple of examples of screw-ups. Doctor may prescribe tablets, 4 tablets a day, and the senior who's elderly might think, well, I'll take all 4 at the same time.
Yeah, you know, taking medications is not an easy thing. Sometimes they're complex regimens, and sometimes you're on multiple medications. Yes. And so to keep them all straight, I need to take the blue pill 3 times a day, the white one 2 times a day. It gets kind of confusing, if you will. So there's a lot of things that we can do to help individuals improve the way that they're taking their medications so they take them as prescribed.
And Chris, SCAN did a study recently that indicated that of all the medical providers, pharmacists were the ones that your members saw most frequently.
Our seniors contact our retail pharmacists on average 19 times a year. And they, by reference, they only see their primary care physician on average 4 times a year.
Yeah. So if we can upgrade the information flow at the pharmacist level, that's good for everybody.
Every encounter with a pharmacist is an opportunity to improve cost, medication adherence, improve quality. So Sharon's leading the way as far as how we work with our pharmacists to do just that.
And Sharon, what are some of the things that we can look to in the future building on that reality?
Yeah, so what we've actually been doing for the past couple of years is providing pharmacists in the community actionable data on our members such that they can ensure that our seniors are on safe medications, and if they're having challenges with taking their medications as prescribed, having a dialogue with them to understand what are the particular barriers that they're having with taking their medications, and what are some practical solutions that would work for an individual such that they do take their medications as prescribed.
So you can arm the pharmacist with the result of this data to help
the pain
him
points.
or her do a better job.
Absolutely. And so just to give you some color of what that looks like, so some of the retail pharmacists, what they'll do is as they're having a conversation with a senior or any individual, is if they get a sense that, let's say for perhaps an individual's having trouble remembering to refill their prescription. Okay. Well, the pharmacy can take that burden on and understands when you're running low on your prescription and can auto refill the prescription and then call you up and say, Mr. Levine, your prescription is ready for pickup. That's one less thing I have to remember and will help me comply with my medications.
And what about a device that an alarm goes off if you haven't opened the top of the bottle at the time that you're supposed to take a pill?
Yeah, so one of the pilot programs that we're actually just about to launch, what's really great is that Chris actually fosters a culture within our organization to try and explore new and innovative ways to improve senior care. And so we're about to launch this pilot program. It's essentially a smart pill box, if you will. and it will let you know in whatever mechanism works for you, whether it's a text message, a phone call, or an email, or actually a noise and sound on the device, that it's time for you to take your next dose. And what's really nice about it, it actually has sensors in the device. And so if you don't take a scheduled dose, it has the ability to either notify a caregiver or even one of your care team members, and they can check in on you to see if you need additional assistance to take your medication on time. So it's a really nice feature for our seniors who are on multiple medications. They have to take medications multiple times throughout the day because the medications actually come to you prepackaged, and you just actually slide it right in. Very easy to use.
Slide it into what?
It's a pill station, and it's a blister
pill
card.
Station.
It's a pill station.
I remember a friend of mine who's sadly passed, but she once showed me a plastic thing of all the pills and colors that she had to take every day. It was about 10 different compartments.
Yeah.
I could not believe it, and that's so easy to mess up.
And you have to spend a lot of time every month to set up your pill box. This comes to you ready, done, and you just slide it in and you're good to go. It makes it very easy and really minimizes the room for error.
And Chris, these kinds of benefits benefit not only SCAN members, but people who go to drugstores in this community.
No, a lot of our benefits we provide to our members, but we really like to also be able to provide these same type of services to our seniors who are not SCAN members.
It just occurred to me that SCAN might be cutting edge in some of these developments based on your vast set of metrics and long-standing relationship with seniors.
Actually, Sharon's very humble, but about a year and a half ago, Steve Miller, who's the medical director for Express Scripts, who manages our networks across the nation, came out and said that Sharon and her pharmacy team were, in fact, on the cutting edge as far as innovations that would really improve, foster our mission and improve health for our seniors.
And I just learned before we went on air that this young lady went from high school right into her PhD program. I've never heard of that one before. Congratulations.
Thank you very much, Art.
Well, final words, Sharon, and we thank you for joining us. But this must be an exciting field to work with, where you're really improving the quality of life of thousands of seniors.
You know what? There's a lot going on in the pharmaceutical industry, like Chris mentioned, with the rising costs. And so there's a lot for us to do to ensure that we get the most out of the medications that physicians prescribe to us.
Wonderful. Well, thanks so much for joining us.
Thank you so much.
We'll be back with the next segment after these messages.
How do you like your chances the rest of the way?
I got no idea. But I do know that if we stay with Naples Rib Company, at least we won't go hungry.
Coach, what do you think about some of those questionable calls tonight?
Oh, yeah. But if you want a sound call, I'd call Naples Rib Company. You can't miss on that call.
Then Naples Rib Company is part of your game plan?
There really is nothing more motivating than a great barbecue meal at Naples Rib Company.
Victory or not, Naples Rib Company, great game plan.
Founded in 1976, Polly's Gourmet Coffee is Southern California's most complete gourmet coffee store. Polly's has the best tasting coffee, freshly roasted every day right in the store, plus a wide selection of teas, an in-house bakery, espresso bar, patio dining, and more. We also offer Wi-Fi, free internet access for all of our customers. Our nationwide clientele agree, when it comes to coffee, there's only one name to remember, Polly's, 4606 East 2nd Street, welcoming you into Belmont Shore.
Phil Trainees mixes California style with continental cuisine that includes fresh seafood from around the world. Since Phil is the chef, the menu has a wide variety of pastas, salads, soups, and appetizers that feature his unique personal touch. And the Italian-American signature dishes are simply beyond delicious. You never know who you're going to run into at Trainees, from the famous sports legends on the Wall of Fame to local celebrities having a drink at the bar. For the best fine dining experience, visit Phil Trainees.
How many times have I told myself? About 112. These internet and phone charges are going through the roof. Is it too much to ask for reliable service at a fair price? There's got to be a better deal out there.
With Spectrum Business, you don't pay more, you get more. Faster 60 meg internet, more advanced phone, at a price that can save you $600 a year.
Now we're talking.
We are?
I said I.
We're back with Chris Wing, CEO of SCAN Health Plan. Chris, Independence at Home is an important program of scans.
You know, it's foundational to who we are and what we do. It's a group of passionate men and women, pharmacists, social workers, nurses, and gerontologists who are really making a difference in people's lives who need just a little bit of help to stay out of nursing homes. So instead of talking about everything we do, we thought we'd bring a short video and actually show you the impact of what we do.
Let's take a look.
I'm here all alone during the day by myself, and if I fall, I don't have nobody to help me get up.
And my dad is used to being an active man. It bothered me to see him here and not doing anything. I have siblings, but they don't help.
The referral source was really concerned about him being alone.
My health doctor at one point said, "There's nothing more we can do for you. We're going to institutionalize you. We're going to put you in a home because you cannot function."
Through my dad's healthcare plan, they put me in contact with Independence at Home.
Well, that's an example of the benefits of the Independence at Home program, improving the life of that woman and that man.
Yeah. And we do it all the time, day in and day out.
I know that your personal history embodies an example of the importance of SCAN's mission.
Yeah, when I was about 8 or 9, we had to put my father in a nursing home, and he spent the last 4 years of his life in this nursing home. So coming to SCAN with a mission statement of keeping seniors healthy and independent, I mean, what could be more noble than that? Yeah. You know, it just resonates with everybody that comes to SCAN is really passionate about that. Everybody that's at SCAN has a story about how we've helped their family or their community, but it's deeply personal with me as well.
And you know, you've been good enough to have SCAN be a sponsor of our show for several years, and people do come up to me and say anecdotally, "Oh, my uncle or my cousin or whatever is in SCAN," and anecdotally, it's almost total satisfaction and positive in these random, uncalled for, unrequested remarks.
You know, oftentimes health insurance, especially CEOs within health insurance companies, aren't really rated very highly by their neighbors and peers.
Right there with lawyers.
But being part of SCAN, there's a sense of goodwill. And I think it goes back 40 years, same mission statement, and really living that mission statement for members and non-members. We've made a big difference in our communities. So it's fun to talk about being a member
of
SCAN.
Summarize some of the other benefits for non-members that SCAN provides, like the volunteer action for aging and others.
Well, obviously everybody's aware of every Thanksgiving we deliver about 3,000 or 4,000, turkey dinners to people who otherwise would not be celebrating that day. We have our volunteer action for aging, which is fantastic. We link up computer. Well, basically we take college kids and seniors and hook them up so that the kids are teaching the seniors how to access
when you have a problem with your computer, if you have a 10-year-old, you can solve it.
Well, for seniors who are alone, all of a sudden to be able to access the internet, it opens up a whole life for them.
It does. It opens up a whole world.
And the Connecting Provider at Home, that's a new program that we're really excited about, but that's not limited to our members. We're going out and put these social workers, these care navigators into the community, working with some of our physicians, but not our members, to show them how we can keep these members healthy and independent.
And needless to say, the baby boomers are coming in waves, which has to be kind of exciting but potentially problematic for many healthcare providers. But this army of people are moving into Medicare, and eventually
they're here and they're coming. And I think some of the programs we offer, we really applaud some of the things the federal government's taken as far as the focus really now is on improving care, reducing costs, and improving satisfaction. And I think some of the programs that the 12 Angry Seniors started 40 years ago, are really well-positioned SCAN to have a bright future and make a meaningful impact on our communities, but especially on seniors' lives.
Well, 40 years is a long run anywhere, so congratulations in advance on that. I know you'll be doing some special things in the 40th year.
It'll be a special
year. The 5th year of your leadership here at SCAN. But speak to a moment about the future and what you see happening.
Well, we've assembled a group of people The team we've got at SCAN, I could not be more proud of them, as evidenced by the stars, the CAP satisfaction, the providers we work with. I've often said the biggest asset that SCAN has on the balance sheet is the trust we have with our members, with our employees, and with our providers. So I'm really excited that SCAN is going to have a really bright future. And the 12 angry seniors, they're going to be even more proud of SCAN over the next 40 years.
Maybe they won't be so angry anymore.
Yeah, well, they won't be so angry. They'll be go, wow, you guys are doing what we wanted you to do 40 years ago.
Okay.
It's a legacy.
Okay, we'll be back with the rest of our show after these messages.
Phil Trainees mixes California style with continental cuisine that includes fresh seafood from around the world. Since Phil is the chef, the menu has a wide variety of pastas, salads, soups, and appetizers that feature his unique personal touch. And the Italian-American signature dishes are simply beyond delicious. You never know who you're going to run into at Trainees, from the famous sports legends on the Wall of Fame to local celebrities having a drink at the bar. For the best fine dining experience, visit Phil Trainees.
There's a world of opportunity available through the College of Continuing and Professional Education at Cal State Long Beach. Would you like to move ahead in the field of human resources and personnel management? Sign up for the Human Resources Management Certificate Program. You'll learn how to expand your knowledge and skills and advance in this dynamic industry. For more information, contact the College of Continuing and Professional Education at Cal State Long Beach.
You've been planning this moment for a long time. It couldn't be a more perfect moment. And you have the perfect ring that will tell her, I want to love you forever. But nothing is perfect.
Don't listen to that guy. He got the ring at McCarty's.
McCarty's makes a moment.
At Performance Plus Tire, you'll find we carry Toyo tires. For over 50 years, Toyo has been a world leader in the development of high-quality tires. Optimum performance, safety, and a comfortable ride. That's what makes Toyo tires great. And now come into Performance Plus Tire for a great deal on these Toyo tires. Proxys ST, Open Country AT, and Proxys 4. Toyo tires, driven to perform. Come in today and we'll install new Toyo tires on your vehicle while you wait. Performance Plus Tire on Cherry Avenue, 1 mile north of the 405 in Long Beach.
I think Long Beach is very fortunate to have as part of the greater Long Beach community an entity like SCAN Health Plan, a $2.0 billion Medicare Advantage plan that not only provides services that you heard described tonight to their members, but also many other services to non-members, to be just people in the community. We'll put up that telephone number again if you want to contact Independence at Home. And Chris, any last words that you want to say?
Well, it's been 5 years since I started as a CEO of SCAN, and it's been a really rewarding experience. We really are a purpose-driven company, and it really is fun to be part of a team now at SCAN that really is respectful of that legacy from those 12 angry seniors. We think we're well positioned. We love being in Long Beach. We think this is a great community. We love being part of the St. Mary's, community. But I think as we go the next 40 years, the things we've learned, and we've made mistakes along the way, but the things we've learned over the last 40 years really position us to really fulfill our mission statement and to invest even more in our community benefit, because that's really the exciting part, Art, is to do more and more for the community that aren't part of the SCAN members.
Well, congratulations on 40 years. Congratulations on 5 years for you. Thank you again for joining us. And thank you at home for being our guest. Please be with us next week for the next edition of our show. Good night, everyone.
Straight Talk has been brought to you by the Port of Long Beach, the Press Telegram, and SCAN Health Plan. And remember, Straight Talk is viewable 24/7 at straighttalktv.com.